All right, so prone positioning and ARDSnet protocol by me, Nicholas Riesenberg. So first off, we're going to talk about pulmonary circulation. So here's an image of the pulmonary circuit. You have all the components there. So the pulmonary circuit is the part of the circulatory system that connects the heart to the lungs. The purpose of this is to facilitate gas exchange. So the order that the blood moves through in the pulmonary circuit starts with the vena cava, bringing deoxygenated blood back to the heart, and then the blood flow to the right atrium, through the tricuspid valve, to the right ventricle, then through the pulmonary artery, to the pulmonary capillaries in the lungs. And then it'll go to the pulmonary veins, to the left atrium, through the bicuspid valve, and to the left ventricle, which then will be pumped out systemically throughout the body. So acute respiratory distress syndrome, ARDS, better known as what we talk about it. So it occurs when fluid builds up in the tiny elastic air sacs alveoli in your lungs. The fluid keeps the lungs from filling with enough air, which means less oxygen reaches your bloodstream. This deprives your organs of oxygen they need to function. And that elastic air, all that going on is basically saying there's a lack of compliance in your lungs. They are not working efficiently. They're not being able to fill and push air out efficiently at all. So we're going to expand on ARDS a lot later in this video, but ARDS is a serious respiratory disease that affects roughly 190,000 Americans a year, which is quite a lot. So typically in a hospital setting, patients are lying supine, meaning on their back, and prone positioning is when the patient is laying flat on their stomach. So prone positioning is just how you're laying in your bed. So essentially what that's saying there is instead of laying on your back, you're laying flat on your stomach. So it is utilized with patients with various respiratory issues. These issues vary from acute respiratory distress syndrome, COVID-19, and some patients just with obesity because all the weight on their body and on their lungs, they cannot ventilate properly. Prone positioning will also be further explained in a later video, but the basic concept is that placing patients in this position will improve ventilation and perfusion, leading to an improvement in oxygenation, which is overall the goal.